So we have a presentation that I've been looking forward to. I look forward to all of them, of course. However, there's a discussion on the CDC and what they can do for tribes when responding to COVID. So this is something that I think everybody can relate to at this moment, and how do we respond to COVID in our various communities. So I'm going to hand it over to Rhonda and Erin.
So I am normally the regional director for the Agency for Toxic Substances and Disease Registry, co-located with EPA in Seattle. However, you know, during a time of a pandemic, you kind of get pulled everywhere. And I volunteered to support the Tribal Support Section at the CDC COVID Emergency Response Center. And in doing so, it's been a great experience. I've been very pleased to see a very specific section created to assist tribes and to answer tribal questions, which are often different than what our other partners, the health departments, what they're experiencing. So as I have grown in this position, as you do very quickly, I've seen a number of resources and that have been adapted for tribal use. So I'm going to kind of cover some basic COVID items, but in context of how we have supported tribes. I think we have had over 100, I think it's up to 172 deployers that have actually gone to tribal nations to support their COVID response. And really, we sit in that public health domain. CDC is a public health agency. We are one of many health and human services agencies that are responding to the pandemic. Everything from our Assistant Secretary of Preparedness and Response, who's right neck and neck with FEMA in terms of responding, to the FDA, who's really working on recalls of products that are dangerous for cleaning or whatever those there've been several of those, or in vaccine development. We also have our SAMHSA partners, the Substance Abuse and Mental Health Administration, which is really, you know, trying to make sure that this has been going on a long time. And so that resiliency of how do we handle COVID over such a long time, on top of all the other health disparities that are going on, especially with substance abuse and mental health. So we're just doing so many lanes. CDC is really walking hand in hand with the Indian Health Service as we work with tribes. The Indian Health Service is the medical arm that provides medical care, right, or funds for medical care to tribal members. And they're not really set up to do the public health piece of working to prevent this disease. They are in the medical care lane, but aren't always in that public health lane. So it's been an interesting partnership, and I'm a regional liaison. I have Region 9 and 10, and have weekly meetings with the area directors at IHS, and bi-weekly meetings with all of the area directors and leadership of IHS to really make sure we're in the right lane and helping each other. So in this response, you know, we've been trying to figure out how best to help tribes, and I'm going to go through my little slide deck here, and I have this front piece of need to know about COVID-19. These are items that we are often pulled into when we help tribes, but you'll find that it's kind of applicable to really prevention of the spread of COVID-19. And then I'll talk about our assistance as we go through, but also kind of list what focus list at the end and the resources. So all of this starts with, how does COVID spread? And you know, our science on this has emerged. I think that's the hardest part about trying to be an authority when the science is coming out that changes our messages every day. So, you know, that really COVID is spread from person to person, and it really happens in that close contact between two people. And you can kind of see that diagram where you see droplets leaving one person and reaching another. And that 6 feet line is really where those droplets, they go down to the ground and don't really make it to the other person. That's why we recommend 6 feet. And through these respiratory droplets, you know, they shoot out when you sneeze or you cough or you talk. And so those are the times where you really want to cover your face so that it doesn't reach there. And that's where a lot of our prevention comes from. It can land in your nose, your eyes, your mouth, or even directly in, you know, into somebody right next to you. So, and there are symptomatic and asymptomatic people. And sometimes you don't know if you're sick unless you've been around someone else. And I'll kind of talk through that. So some of the community mitigation strategy, and community mitigation is really how to stop the spread of COVID. You know, these are actions that people can take to slow the disease. And you know, I can't tell you how many times I've heard people say those 3 tenets of public health: social distancing, wearing a mask to prevent it from you know, reaching the other person, and washing hands. All 3 of those are something that, you know, that's just kind of rote discussion. But there's also other, you know, cleaning and disinfection of frequently touched surfaces is another route that we try to prevent. And each community, and really each tribe, and some communities within tribes are unique. Each tribe that we've been working with has different issues, whether there is COVID or there is not COVID within their community, or you have somebody that went somewhere else and brought it into the community. Some communities, the EMS folks had COVID. You know, you just don't know where it's getting in and how it spreads once it gets in. That work of trying to figuring out how it spreads is really where contact tracing comes in. You know, and it really depends on the population. Everything from housing, the number of people that live in a house, and all different kinds of pieces. What is this air circulation in the house? What time of year it is? We're going into fall and winter when a lot of us close our houses. So we may see different, you know, different patterns than we've seen from last March to now. The other thing that's very different about tribes, you know, oftentimes, and if you go to the state websites, they'll talk about infection rates of so many per 100,000 people, and with 20 or 40 or 70 or 9 per 100,000 people. And with our tribal populations, not only are there very few that have 100,000 people, where you can see that infection base, but you don't have the same health care that you do with states and local health departments. You know, I live in Seattle and King County, and King County has been at the front of this response, and so when I go to look what's happening in my community, I go to their website. Well, that's not necessarily easy to do on a tribal reservation or in a checkerboard area of a tribe where you're trying to figure out, you know, how does that apply to us as a community and the healthcare services that we have. And so oftentimes it's not about 100,000 people. It's about a healthcare facility that only has so many beds, or you know, maybe we have to go to a local hospital because there is no hospital available. So really making sure that the capacity of the tribe can support the number of cases, it's pretty easy to get overwhelmed very quickly. The other thing that, you know, I've worked with several deployments to tribes and listened to many outbriefings on deployments. And one of the things that really is key in the most successful tribes in stopping the spread of COVID is the leadership of the tribe, and whether it's the council or the government or the board, you know, whatever structure it is, having that council really be on board with all of the mitigation strategy. The tribal health centers, you know, hand in hand, in the similar way that the governor works with his health department at the state. I think having those work. The other thing is data exchange among the tribes and the states, because resources really come in a way where we're looking at numbers. And so if your cases aren't reported, you know, how are we able to divvy out resources as well? So, you know, the data piece is a tough one, especially as tribes, rightly so, have been burned from sharing data in the past. So I think these data sharing issues actually are more in the center of conversations than I expected, but in a good way. So oftentimes there's many strategies in preventing the spread. Everything from promoting behaviors that reduce spread, which I mentioned earlier, having a council that supports and actually promotes or has videos about, you know, wearing masks and preventing spread. Here's a good example. I think this was from a tribe in California one of our deployers took, where you know, focusing on the most at risk, and you know, oftentimes we see stigma that's occurring with families that have COVID, when really the bigger fear, you know, and we need to kind of transition it to we want to protect our elders and our most at risk. You know, people that are that have disease or other items that are at risk. And then the next, you know, this layered strategy approach of having that healthy environment where you are, you know, using the EPA list of cleaning agents that's been approved and looked at instead of others, and in the right manner that they're promoting. The other piece is healthy operations. So each tribe has a structure. Each tribe has, whether it's a clinic or it's tribal facilities. Sometimes there's correctional facilities. There's EMS. You know, all of these different pieces have a set of infection prevention and control measures that can be applied to prevent the spread. And then the other piece is preparing when somebody gets sick. You know, the whole advice around isolation and quarantine. And I'm going to go through a couple of examples. You know, and it's very important, especially with COVID, that people know when to stay home and when to when they can return, and especially in terms of essential workers.
Rhonda, I just
Yes.
wanted to pop in and let you know that you're no longer sharing your slides.
Oh,
So
what
just so you know.
happened there? I apologize. I'm not sure what happened. Thank you. Can you see them now? Yeah, I see Erin
Yes, we
nodding.
can. Thank you.
Right. So when to stay home and when to return, if you're sick or tested positive, we isolate. And really this is to keep people with symptoms away from other people. And that's usually recommended from 10 days after you have symptoms or a positive result. And then quarantine is if you've had someone within close contact. CDC defines a close contact as being within 6 feet of someone who has COVID and for more than 15 minutes. So, walking by somebody quickly may not be a close contact, but if you have been quarantining for 14 days, really just to be sure that you don't develop symptoms. Sometimes the whole house may quarantine together, yeah. I think I'm trying to get to my next slide. There we go. So one thing that has come up with many tribes is, how do you isolate or quarantine in multi-generational homes? And especially when you can't, when this is the space you're living in, and it is difficult, and it's not always, there's different strategies that can be. You can isolate the person within the home if it's possible. If you have to share a room or even share a bed, sometimes sleeping head to toe. Making sure that when that person uses the bathroom to disinfect before they leave. Also not having the caregiver be someone who's at risk, an elderly or pregnant woman or with underlying medical conditions. In several of the tribes, the epidemiologists that we've sent to support have found that elderly women are actually, there are more cases among elderly women. And this, I think, goes a lot to our aunties who are helping take care of our children or taking care of our families, and just being able to provide support so that does, to prevent infecting our most at-risk people. So I did want to mention contact tracing, and contact tracing is something we support a lot with the tribes, and oftentimes because I mentioned where the data is coming in from tests, it could be the state, it could be a lab, it could be a tribal clinic, it could be an IHS clinic, trying to figure out where where the data is coming from and how do you stop the spread. There are a case, which is somebody who's been positively tested for COVID or has symptoms. Even with symptoms, we treat them like a case. And really what happens is medical personnel collect key information to try to identify where they were exposed. And then starts contact tracing, where you start calling the members that they were exposed to find out were those close contacts exposed, and are they having symptoms, and most importantly to advise them to quarantine. And really that has to occur, I've seen different scientific presentations at CDC, but really between 4 to 6 days, after 6 days of the contact, you're losing, you have lost the power to control the spread from one event. And then monitoring different states and tribes do it different ways. There are things like Sarah Alert or text illness messaging where you can do that automated follow-up and monitoring. And then also public health nurses follow up to find out, you know, how you're doing from a medical point of view. Do you need more? And then promoting behaviors that reduce the spread is probably the best way to control the spread. I think most of the Western, at least Oregon, Idaho, and Alaska have been doing a pretty good job with controlling the spread through masks, and there are big campaigns that are very visual. But again, you know, educating and staying home, hygiene, you know, really counting to 20 when you're washing your hands, those ABCs, just like we teach our kids when they're learning. And if there aren't water sources, which happens in a number of tribes across all 4 of these states, you know, making sure that the sanitizer is available or water is delivered. And so there are all kinds of different CARE Act funding that have been used to promote that in that way. And then just teaching the proper use of face coverings, and then making sure that hygiene supplies and PPE for workers, which is pretty important. And I think that's one of my next points, which is healthy environments. We have infection prevention and control specialists. A lot of them are from the National Institute of Occupational Safety and Health, or NIOSH. They're industrial hygienists that that are deployed and work with the tribe to talk about their worker safety. And I've seen some excellent work come out of one of our deployments that worked with the correctional facility in making sure that members are isolated, especially, and if they start seeing multiple cases, when to keep them from congregate housing versus isolation housing, and sometimes that can get tough, especially in correctional facilities. But in addition to that, transport vehicles, everything from taxis and medical transport for maybe dialysis, you know, looking at the practices that transport vehicles are using, looking at, we've worked in a number of casinos with the owners of casinos. They're usually tribally owned, and like to be separated from maybe the tribal authority or even the health clinic. You know, that's kind of a separate business interaction. But our teams have been pretty successful in making sure, you know, with ventilation, looking at proper HVAC issues, but and other issues that come up in terms of frequently, you know, touched places or disinfection. And then always promoting a physical distancing. You know, you see X's on the ground at the grocery store for that 6 feet, and that happens in many different venues. And then in terms of operation, this is kind of what I was talking about in other places, you know, protecting the vulnerable, and be aware of state and local, or in this case, tribal and health, you know, regulatory policies, limit gatherings. Oftentimes we see, right now I just came from a call where there was an exposure event in Dillingham, and there's a lot of concern about how, you know, who is in contact with whom. So limiting those gatherings, or if there is gatherings, try to make sure it's outside or in a well-ventilated area, or a fewer number of people. Communications and messaging is super important. How do you, you know, and adapting, you know, kind of typical messaging in order to reach tribal communities. We've worked with them to to have infographics, things that are easy to read, easy to understand, and to promote. And then workplace kind of scheduling and enforcing and wearing masks. And there's just a few things there. And then we've worked a lot, you know, I think tribes are very good at actually preparing for natural disasters, because that's where a lot of the FEMA funding has come from, and we know what to do, or we make plans on what to do if there's an earthquake or a tsunami or even a smoke event, as we've recently experienced. But I think now adding into that, what do we do when there's a pandemic, and making a plan for that, I think I've heard, you know, our tribal senior liaison likes to say the silver coin in this lining is that the funding that is coming to tribes is really able to develop that health plan. And then when to notify the health department, which health department to notify, and testing and how testing information is promoted. And really contact tracing is personal. It is about who did you talk to, and then you get a call and say so-and-so told me that you were with them, and it gets very personal. And so kind of walking that line of protecting privacy, but also working to stop the spread in a community. Both of those are very important. And then establishing those cleaning and disinfecting protocols, just you know, having regular protocols in the house, at work, you know, and those kind of things. Oh, I think I had this one in there twice, maybe. So how do we partner? Well, we've done it two ways. We've done it by remote, or we've done it by deployment. And everything from a tribal liaison officer, which just connects information or subject matter experts with tribal staff that need help, and protocol reviews, strategy, and implementing different things, and we try to tailor it to any one community. We've also deployed epidemiologists, contact tracers, and done a lot of training with tribes, and infection prevention and control with our NIOSH partners. So again, we do a number of things, and just how we do it is very tribe specific, and we have deployed a lot. Our deployment pool is getting low, so we're trying to get to the right place at the right time. So there's some resources on here. I think these slides are going to be provided to you. Any tribe can ask for assistance at EOC event 362 at cdc.gov. And I'll pass it to Erin.
Thanks, Rhonda, and hi, everyone. So I'm with the Tribal Air Program, and just wanted to thank you for having us today. And on the Tribal Air side of things, the tribes that we've been working with have reached out to us with a lot of different questions on the air quality side as it relates to COVID. And there are certainly a lot of questions, and as Rhonda said, just emerging science, and things are evolving over time. And so we're trying to keep track of that and work with our partners and get the information out to get some answers, especially to some common questions that we're getting. So I just wanted to draw your attention to the EPA website. We do have a coronavirus section on our website, and there's a lot of great questions, not just on the air side, but the one that I highlighted here was just about, you know, a common question we get is about air cleaners and air purifiers, and will that help our family protect ourselves from COVID-19? And so the answer for this one is to some degree it will reduce indoor air pollutants, but it's not enough on its own. So that's just an example of a question that we get really often. There's also a lot of information, like Rhonda mentioned, about cleaning and disinfecting. I did just want to note, being in the indoor air program typically, we've recently just heard about, the number of calls to the poison control centers have really increased since the pandemic began, because a lot of people are trying really hard to keep their spaces clean, but then there are a lot of new products being used and sometimes overusing or using them perhaps not how they were intended. So looking at this guidance about when to use the different types of products, how to select a product, when you don't need one, when just basic cleaning and soap and water is enough. So I just encourage you to look at that or reach out. And I do just want to recognize, we're in this really unprecedented time when tribes and everyone are dealing with big impacts of the pandemic. And simultaneously, we've been through this really significant wildfire and smoke season, and some of the strategies for protecting yourself and your communities align for both issues, and then for other issues, sometimes they don't. So while a cloth mask may be helpful for protecting yourself and others from COVID-19 transmission, it's not going to do much for wildfire smoke. And air cleaners are one thing that portable air cleaners or do-it-yourself box fan filters can help for both issues. So again, there are just some details there that make communicating with our communities challenging. And one of the things I wanted to point out is just, I'm imagining a number of you on the call today, I don't see the list, are part of a GAP-funded environmental program or a tribal natural resources program. And I just think the roles of the work that you all are doing is really important. And there are lots of things during this time where you play just such a significant role in being able to impact community health, being able to communicate what the latest and greatest and new learnings are on on how we know, the disease is being transmitted and what you can do. And I noted a couple of key opportunities here, partnering with other programs, particularly maintenance and facilities as you're going back to work and offices are reopening. A role can be sharing the latest recommendations about ventilation. We've seen some tribes developing and sharing COVID Healthy Homes Kit by having safe cleaning products and masks and things assembled to give out, and distributing air cleaners to homes. Tribal Healthy Homes Network is a great resource for information on this and other things, and I'm not going to spend a lot of time here because they'll have a session later this week. But I did also want to draw attention to the National Tribal Air Association, which in its setup is somewhat similar to RTOC, where you have elected representatives for the region from tribes who you'll see listed here, fantastic partners of ours, and also an indoor air quality work group that has put together tribal-specific webinars recently to support tribes on reopening guidance with an eye towards the indoor air piece, so ventilation, filtration, and that kind of thing. So just wanted to make a plug for their important work there. And I'm nearly to the end here. Here are just a couple of links that hopefully we can send out later for some training that might be useful for either you in your position in the environmental world or in a tribal leadership role, or for you to pass on to facilities and maintenance staff or housing or whoever it might be, even schools, guidance around cleaning and disinfecting, reopening, and just how viruses move through the indoor environment. And final plug here, just wanted to mention that if you'd like to know more about this and just really how air moves in an indoor space and different nuts and bolts of ventilation and filtration and what we know on the COVID side, join our session on Friday at 3:30 Pacific, 2:30 Alaska time. I'll be joining Tribal Healthy Homes Network and a partner from HUD, Housing and Urban Development, to share some information on that topic. And I'll leave you with my contact information and a picture of my baby sitting in front of my do-it-yourself box fan. And we'll talk more about that on Friday. So thanks so much.
Wonderful. Thank you, Rhonda and Erin. I appreciate your presentations. And people will notice that sometimes we're presenting with masks on and sometimes we're not. We have a large space that we're in. And so when we're over 6 feet away from each other, we have our masks off. And then when we have to come proximity to each other, we pop our masks back on. So we're doing our best and to follow guidelines. And I appreciate your being with us today.